Hey everybody, this is Dr. Zachary Ward at Life and Alignment Chiropractic here in Auburn Hills, Michigan. On the screen in front of you is my somewhat now outdated website uh, for my practice. I have a number of different articles on there, and one of those that I have on there is called "The Most Embarrassing Pain of All: Pudendal Nerve Pain, a Short Guide." I'm making this video for you if you're just looking for some entertainment and this topic interests you, great, but I'm making it for you if you're one of the many people who have emailed me over the last couple of years looking for some sort of connection to someone who can give them an answer on this. Probably the best and most concise thing I could possibly say about this is actually in the article in front of you, "The Most Embarrassing Pain of All: Pudendal Nerve Pain, a Short Guide." Go ahead and find that. More likely than not, if you're seeing this video and you're seeking this particular video out, it's probably because you've already read this. Maybe you've even gotten in contact with me. I wanted to show you in this video what it is I'm looking for as a practitioner in the way that I practice in order to try to solve some of these issues. Okay, some of the symptoms related to pudendal nerve pain. So I'm not going to go over what pudendal nerve pain is and kind of get into the nitty gritty and why this is overlooked, etc., and the issues related to if you have pudendal nerve pain and how frustrating it can be. I just want to get into the mechanics of what it is I'm looking for, and so we're gonna jump right into this image here. This image is a cross section. So basically, imagine that we're looking at you from the side and we're slicing you right through the middle of your nose and the back of your head, and it goes to the middle of the chest, all the way down through the middle of the abdominal area, and then it starts reaching the pelvis, and we go, right through here like that. We're seeing in the middle of you, and so we're seeing one half of your body, and the front part of the body is here, and the back part of the body is here, and what you're seeing is the sacrum bone and the fifth lumbar here, so the middle of the spine, and you're seeing the ring of the pelvis, and you're seeing the top of the ring here, and you're seeing the bottom of the ring here. And this ring is important, and I'll show you what I mean by ring in another image of the entire skeleton. What we're seeing is what's called the sacral plexus, or the lumbosacral plexus, which is a nerve bundle system that comes out of these in between these bones here, and this bone is now a single bone that has been fused. It usually starts in childhood as being non-fused, becomes fused as an adult, and we have these different nerve roots coming together to leave and exit through and come back in for a certain portion of these nerves, an area of the lower pelvis. And one of those nerve extensions is called the pudendal nerve. And that pudendal nerve does a number of different things in males and females, but it can result in a lot of pain in this area, down and through here, and in the male, which is what the model we're seeing here, even out to the end and the tip of the penis, problems with erections, etc. Okay. So what I'm looking for as a upper cervical and what I call structural chiropractic practitioner whose focus is primarily how the neck relates to other areas of the spinal column and why this matters to the pelvic floor is this, and we're going to draw this a couple different times. Okay, and I haven't really put this out in this explanation in this form anywhere else that I've made, so bear with me here. But your body has multiple different planes, and tension travels along those planes. And one of the principles that I'm operating from is that the body is smart and is intelligent, and as a mechanical being, you don't just follow what we call maybe the normal rules of mechanics that you might find, on a shop floor. But you're operating from a system of what we call tensegrity, which means you're kind of inflated and open, like a balloon or a tent. And so tension doesn't just exist in one part. Your body will work to spread that tension out over the entire body as much as possible. Okay, so what I mean by this is if there's a problem up in here, your body will not just allow that problem to exist there. You will begin to spread that tension out into here, possibly down into here, and this whole chain will maybe affect it down the left side. Okay, so you have multiple different planes that we can divide you in. We could divide you and look at you through the front here. We call this the frontal plane. We can look at you from the side, which is here. We call this the sagittal plane. Okay, and then we can chop you through here and look down through the top like this. Okay, looking down through there, which I'm not going to show you that plane because it's really hard to see what we're talking about. We call that the transverse plane. And so you have 5 major transverse planes that are important in terms of distributing tension. Here's the first one. Here's the second one. Here's the third one. Here's the fourth one. And here's the fifth one. You have a lesser plane here and here at the knees, and a lesser plane here and here at the ankles. These primary transverse planes will contain tension when the body mechanics are off. Okay, so any mechanical problem anywhere in the spinal column will create tension at all 5 levels. In other words, if you have a major trauma here and a shift of the vertebrae, there will be tension here, 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 and there will be tension here as a result of that trauma. Okay? If you have trauma up in here at this level, there will be tension here, there will be tension here, there will be tension here, and there will be tension here. Okay. So when we're looking at the pudendal nerve root system, we're looking down in here into the sacrum, we're looking at the nerve roots that come out and internally make travel within the pelvis and through here. Okay. The pelvis, in terms of these transverse planes of tension, is actually subject to 2 different planes of tension, the top of the pelvis and the bottom of the pelvis. So what I would call transverse plane 4 and 5. Pelvis is like a bowl, shaped like a bowl. And the top of the bowl and the bottom of the bowl. And there can be stress here and stress here at the top and the bottom of the bowl. Now remember what I said, stress here, 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 and here from any mechanical aberration anywhere in the body. Okay, so what we're looking for in terms of what I'm looking for structurally in terms of the shift of the posture and why people oftentimes don't get significant change in the pudendal nerve pain is because if they get an accurate diagnosis, they're getting inflammation right in this area here. They're going through those nerves, and the only place where they ever get treatment is here. And so they'll get maybe some pelvic floor rehab or some actual mechanical rehabilitation where someone goes in, if a male through the rectum or possibly through, if a female vaginally and also through the rectum, in order to release the deep pelvic floor muscles that are in here. Okay, and there's nothing wrong with that. That's a good thing to do. And don't hear me saying that if you receive that's wrong. No, it's not. It's not wrong. It makes sense. Makes mechanical sense for you to get that done. However, if the line of tension here, line of tension here, line of tension here, line of tension here, and line of tension here aren't all reduced at all 5 levels, then there can still be torque or torsion within the system. Okay. So what I'm doing in my practice and what other people in my practice who practice like me are doing is we are looking at this as a total functional unit, knowing that the neck from here to here drives a lot of how much of this tension is spread over the body. In other words, the more correct this becomes, the less tension there's going to be here, 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 and here. And subsequently, the less tension there's going to be on that pudendal nerve. Okay, and it's really as simple as that. So anybody who comes into my practice with the complaint or looks like they've got a pudendal nerve problem, whether they have had an official diagnosis from another practitioner within the medical community, we're always going to look at the stress that's here at this junction here, because of how the brain interprets what is going on at this level, we can decrease a lot of distortion across this whole system by making sure that this is fully released. Okay? And we have a protocol and a sequence to do that. And that's important that is done. And so, again, I'm just going to reiterate this point. The symptom may be through here, but the tension that is here is going to be related to tension that is here at the diaphragm, here at what we call the cervical thoracic junction, and then here at the cranial cervical connection. Okay. And so ultimately what you're getting with upper cervical chiropractic care, with structural chiropractic care, with some of the work that I'm doing with quantum spinal mechanics, is we're getting a release of one of these primary areas and then this secondary area in order to see relaxation here, here, and here, which has to be done in order to get the full release of the tension that's down in here. If you have any questions, let me know. Thank you for watching. Thank you for listening. Again, Dr. Zachary Ward here at Life and Alignment Chiropractic in Auburn Hills, Michigan. Again, the article you can find on my website, The Most Embarrassing Pain of all, Pudendal Nerve Pain. That's me here. You can go ahead and check it out at laachiro.com. Thank you so much.